One researcher at UW Health tries to find a breakthrough in the quest to cure brain cancer, and she thinks artificial intelligence may lead her there. Dr. Pallavi Tiwari has spent the last 8 years of her career using AI technology to develop models that track the progression of brain cancer. Now, ultimately, these models can improve treatment outcomes for adults and children. These images are sourced from existing patient scans at medical centers nationwide and have a 90% accuracy rating.
Do we really want to subject these patients to these poisonous drugs, treatments that don't work, or should we identify better treatments that are suitable for the kind of tumor that the patients have, and the treatment that they might respond better to?